Thank you very much, Prof. Kaur, for your nice introduction. May I have my slides, please? Okay, good afternoon, everybody. It is my pleasure to have the opportunity to talk about how national health surveys have influence on national policies. Next slide, please. This is what I want to share with you. Next slide, please. So why health surveys for policymaking? This is to understand the magnitude of nutrition and health problems, determinants of the problems, and the social and economic context of the nutrition and health problems using information that was collected based on a standardized way in a sample of people to better understand the situation in a larger population, for example, national level. As such, the policy developed can be translated into effective programs or interventions. Next slide, please. In addition, use of information from surveys that is available from various countries facilitate country tracking the progress and make comparison with other countries that may lead to global or regional policy recommendations. Next, please. This is the example of using national surveys is to make comparison among Southeast Asian countries. For example, as you can see, Indonesia is the highest prevalence of stunted, even though it's gone down to 24%. Next, please. So this is the targets, the list of targets for tracking the 2025 global nutrition targets. Those are anemia, low birth weight, exclusive breastfeeding, childhood stunting, wasting and overweight, and adult obesity and diabetes. Next slide, please. So basically, the maximum target achieved by countries globally were only 5 targets and 2 targets for Asian. This is for various reasons, including the number of targets achieved was not necessarily reflecting the real progress, rather that the data availability and quality might differ across indicators because of different methodologies and modeling approaches taken. For example, maternal and infant and young child nutrition indicators were analyzed based on surveys that mostly cover low-income and lower middle-income countries. Therefore, it was not representing the overall global picture. Data for anemia, low birth weight, and the diet-related non-communicable disease was achievable for all countries, but was available for all countries, but based on modeled estimates. Therefore, the information may not represent the actual country level status accurately. Next, please. This is the Asian countries' achievement. 3 countries on track for 0 targets, 5 countries on track for 1 target, and 3 countries on track for 2 targets. So I will speak about Philippines, Indonesia, and Thailand. Next, please. This is about national surveys in the Philippines. The Philippines National Statistics Office has conducted national demography survey every 5 years since 1968. And starting 1993, National Demography Surveys is the first national sample survey undertaken in the Philippines under the auspices of the Worldwide Demographic and Health Surveys Program. The following NDHS was conducted until 2017. The results of NDHS has been providing input to policy formulations as well as to monitor activities and research in health and family planning. Next slide, please. The importance of data for policymaking is highlighted by Department of Information and Communication Technology of the Philippines, which is data gathered can help government agencies monitor programs and develop evidence-based projects and policies geared towards improving the lives of Filipinos, especially now. Next, please. On the surface in Thailand, I'm using evaluation done by Sripan Tantives et al. In 2019. Since 1991, the government of Thailand has conducted the National Health Examination Survey and HACE periodically every 5 years. And HACE 1 and 2 were led by the Ministry of Public Health and then led by a special office affiliated with the Health System Research Institute. The use of enhanced data for policymaking, monitoring, and evaluation then is limited. The main reason for not using enhanced data among policymakers and technical officers is the existence of other surveys that have similar health topics with quality as good as enhanced. In addition, there is alternative health surveillance platforms that provide similar information in a shorter time instead of 5 yearly. Next slide, please. The study provides lessons from Thailand's enhanced, which might be helpful for other low and middle income countries in using data for policymaking. The existence of other surveys, large and small scales, which are conducted and funded by different institutes, were done without common policy directions and alignment mechanism, for example, for prioritizing survey topics. In addition, the study stated that there is lack of governance structure and functions. Next, please. Indonesia has been using national surveys to obtain various information to be used as the basis for policymaking. In 1963, the National Socioeconomic Survey, or SUSENAS, a series of large-scale multipurpose socioeconomic surveys, was initiated and conducted every year by the Central Bureau of Statistics. Since 1992, SUSENAS was supplemented by 3 modules covering about 60,000 households that are rotated every year to collect additional information, including health and nutritional status. Next, please. In response to the needs for more detailed information related to the health and nutrition, in 2007, the National Institute for Research and Development, Ministry of Health, started Indonesia Basic Health Survey, we call it FrieslandCampina, and has been repeated 3 times. The latest one is 2018. The survey contained health and nutrition questionnaire, and FrieslandCampina was purposefully designed to be in link with SUSENAS so that some information can be shared each other. FrieslandCampina was designed to be alternately representative at district and province level. As such, this will allow each district to adjust the policy and program in the context of their situation. Next, please. We have also other national surveys going around. One is Indonesia District Health Survey since 1987, and there are also 2 other national surveys, intercensal surveys of SUPAS, Village Potential Survey of PODES. Both SUPAS and PODES can be linked with SUSENAS and DISCUSDAS. There is one non-government survey conducted by RAND Corporation and Indonesian Institute called the Indonesian Family Life Surveys. Is an ongoing longitudinal survey in Indonesia. Despite of the benefit of the longitudinal study design, because the survey is conducted more rarely, the use for policymaking is more limited. Next, please. So the surveys in Indonesia basically used to obtain coverage of outcome, output, and input indicators, assess the trend of achievement on various indicators by time, also obtain information on disparities by several aspects, to assess determinants of health and nutrition problems, and then also to be to compare with other countries, for example, Asian countries. Next, please. The government is concerned about malnutrition problem in Indonesia. Therefore, together with the reduction of maternal mortality ratio and infant mortality rate, the current government has put reduction of stunting as one of the 3 national priorities. Consequently, there is a need to monitor the progress of reduction more frequently and to assess the important determinants of malnutrition. Since 2019, the government initiated Indonesia Nutritional Status Study, SSGI, which is conducted between 1 or 2 years and expected that the information can be used to evaluate program and policy and program every 1 or 2 years. Next, please. This is the results of the surveys comparison between 2018 to 2021. And next, please. This is the results of 2019. the prevalence of stunted, the range between provinces from 14 to 44%. Next, please. Next, yeah, this is the 2021 surveys. Similar, even though there is better to some extent, but the disparities is still big. Next, please. So SSGI is also used to diagnose, basically, to categorize the provinces, whether it is acute, chronic, or acute and chronic provinces, based on stunted and misted problems. There are 27 provinces considered as acute and chronic provinces based on stunted more than 20% and misted more than 5%. Next, please. This is just another example of use of data to be considered. For example, that about half of the under 5 children in Indonesia is actually stayed in 5 provinces in Java. Next, please. So the SSGI results were used then for health for the 6 health transformation, with special attention for transformation of primary healthcare. Next, please. SSGI is also used to require use based on presidential decree or regulation that require MOAs to be responsible to publish stunting prevalence every year, assess the stunting achievement at district or city level to determine the local incentive fund from central government to district or cities, and use as the basis for evaluation and assessment of progress of specific and sensitive intervention from all related sectors at central and local level. Next, please. Well, we have challenges among other challenges that we have. There is different perception about the quality of such a big survey, especially related to the measurement of nutritional status. Pandemic has caused constraints in implementing the survey offline, especially for certain measurements such as nutritional status, and lack of sufficient data at sub-national level to analyze determinants of malnutrition at district level, while the program are decided by local government following policy direction from central government. Next, please. So as conclusion, national health survey have been used by country as the basis for national policies development. The use of national health surveys can be useful as a tool to monitor and evaluate the program, which may lead to policy adjustment. National health surveys have been useful for making comparison of target achievements among countries and offer lessons to be learned across countries. Challenges remain, such as the need for a good governance structure and function when various surveys are available, pursuing quality data, obtaining data for national and sub-national level at the same time, and pandemic uncertainties. Thank you very much.